So, everybody ready for the HESI? I'll tell you what,
Getting ready.
it's pretty basic here. If you spend some time on your HESI prep, you're golden. You're going to be fine.
Looks like I
That,
could ask her.
pardon
Okay.
me, that HESI prep is your guide to studying for HESI.
Wait, what? Oh, the one that we've been doing, right?
Yeah, the one you should have turned in
Okay.
last Sunday.
Yes. All right.
All right. So, if you guys want to pull that up. I'm going to share my screen and pull mine out. This. Okay, I have an empty one. That's what it looks like at the start of the term. So when you think about, well, first of all, remember that the HESI is entails all your classes coming together, just kind of like your exams, but on a bigger
I think
scale.
you got the wrong one for us, right?
I'm sorry?
Because I don't think we had Ebola on ours.
Oh, that's an old one. Sorry. Sorry. All right, let me stop sharing for a minute. Hang on one second. Sorry.
That's okay.
Nope, that's not it either.
It's the one that started with anthrax.
Yeah, I just need to pull it up. Hang on. One sec. Yeah, that's what I want. Okay. Don't want that. Don't want that. Oops. I want that. Okay. All right. Sorry. This one. Okay. Okay. So, as in your exams for community, we're bringing everything together, right? Your exam is going to have community, med surge, geriatrics, pediatrics, fundamentals, right? Which is what we've been talking about this whole term, right? Providing care in the acute care setting involves Geri, peds, OB, fundamentals, pharmacology. Well, there's no math on your HESI, but that's all in the acute care setting. But then as we move into the community and do our care in the community, all those subjects apply, right? So we said at the very beginning of the term, this is med surge focused HESI because you're bringing everything together. The only difference is it's a change in setting of where you're providing the care. Right? So think about it. Where might you be providing community nursing?
In the nursing home,
Nursing home?
the patient home,
The what?
the patient home,
Oh, yeah. Home care. Yes. The patient's home. Where else?
Clinics.
Clinics?
Is the school
Schools?
nurse considered one?
School nursing?
Mm-hmm.
Faith community nursing, right? Within your congregation?
Mm-hmm.
Hospice nursing? Occupational health nursing, which is the work setting? Medical office buildings, urgent cares? Every place that's not an acute care setting is considered in the community. So when you're looking at these questions, yes, they made me have a base of med surge, have a base of peds, have a base of maternity, have a base of geriatrics, but it's focused on care in the community. So when you're taking this exam, the care is focused in the community. So don't be thinking acute care. Right? You have a foundation of med surg skills. You're going to be using those basically the same, whether it's acute care in the community. But just remember when you're reading these questions, these are community questions, but they involve all different aspects of nursing, right? So when you look at all these boxes that you filled out, I think I have Christina from my class. I don't know. Do I have anybody else from my class? I don't think so. I haven't looked at the other HESI preps from the other instructors, but the students in my 3 classes, they were phenomenal. They were phenomenal. If you looked at the nursing process all the way from assessment to evaluation, which each of the boxes. So remember, these questions are focused from assuming you have acquired the knowledge over the term for community, assuming you've acquired the knowledge in your med surg class, in your peds class, OB, all those classes. Now, this is the next gen style, right? Now the questions are going to be clinically focused, right? We use the term clinical judgment. And so when we ask you to fill this out at the beginning of the term or have it being filled out throughout the term, we ask you to think about clients in a community setting. All right. So let's say we're not going to go through every box. So I'm just trying to get you in sync about how to think about it. So anthrax incubation. So all these boxes represent topics that are covered on the HESI. Okay, so there's a question about anthrax incubation. So think clinical judgment. What might be asked? What do you think? What's a clinical judgment question about anthrax incubation? Could it be maybe a teaching question? I don't know the questions. I don't develop the HESI. HESI's developed like NCLEX. It's from a bank of 1,000 questions.
So you never
Means,
got a chance to
means,
see?
Say that again.
You never got a chance to see what type of questions it is?
I
No.
know I can share with you the topics. That's all I
Right.
know. I don't know the questions on the HESI. But
Okay.
I do know the concepts and the topics they're covering. So there is a
Okay.
question
Yeah.
about anthrax incubation. What do we think a clinical judgment question would be?
means of contraction.
Okay, yeah,
Probably the proper PPE that the team should be wearing.
exactly.
Something, yeah, something in that sort.
Yeah,
A
anthrax
rooming question, probably.
a what?
A rooming question, like how possibly how can a person how would you room a person with anthrax? Can they share a room with somebody or should they be in a private room?
Yeah, let's think our ad pie. What might they present with when you do your assessment? This is all the
Sure.
information you put in your HESI prep, right? What might they present with? Think about, you start with assessment, right? What are they presenting with? All the way down to evaluation. What are you teaching? You know, maybe what we need to know about anthrax incubation is the incubation period in order to be able to do that assessment or that plan of care for somebody who's been exposed to anthrax, right? Disaster. So, disasters in the community. You all filled out the HESI prep and identified what a level 1, 2, and 3, what are those phases of disaster? Okay, so if there's a question about level 1, 2, 3, maybe it's giving you a scenario. I don't know. We're trying to problem solve together. Maybe giving you a scenario of what's going on with the disaster, and they're asking you to pick which level it is, right?
Mhm.
What about disaster planning? What do we think? What do we need to know about disaster planning from the community perspective? What's important with disaster planning from the community perspective?
Preparedness.
Preparedness, of course.
Time
So
of response.
what's our part? What's our part in disaster planning?
Training and educating the community.
Exactly. Exactly. Red triage tag. Well, maybe they're gonna present different types of clients with different stages of injury or trauma, and you have to identify which would be a red tag. What is a red tag?
The person has means of surviving.
Say that again.
The individual has means of surviving
Has
from
means
whatever
of
tragedy.
surviving. Yeah.
Mhm.
What's important with disaster communication? What's the purpose of disaster communication? Think about your community.
Sharing information.
What?
To make people
Oh,
sharing aware.
Communication, maybe before the disaster, during the disaster. How do we keep people safe? And post disaster, what do we do? Right? Natural disaster preparedness, kind of the same type of question. What's a natural disaster?
An earthquake.
Earthquake.
Okay. Okay, let's move into epidemiology. What about flu surveillance? What's a clinically focused question with regards to flu surveillance?
Maybe like when the last time you got your flu shot or
Yeah,
something like that.
that's what I'm thinking.
Making sure they up to date on their shot.
Yeah, it's flu surveillance. So, and then maybe not only vaccinations, but what's the flu rate in the community for the year or for the winter, right? Surveilling the flu. What's SARS?
Severe acute respiratory syndrome.
Okay, so what do we think? Thinking nursing process. What are we thinking for a clinical question, clinical judgment question? Maybe what they present with. How do you diagnose it? How do you treat it? Is it infectious? Is it communicable? What do we teach about recovery? CDC reportable diseases. I don't think you need to know the list of what's reportable. What I'm thinking that we're talking about here is what kinds of what are CDC reportable diseases? What does that even mean? What's that mean? This is your review.
HIV. I know people have to like report that you have like HIV
Yeah.
or
Maybe the
even
most
TB.
maybe the most common infectious communicable diseases that are reportable. You're right. Hepatitis, HIV, TB. But simply knowing that there is a database of certain high risk infectious communicable diseases that need to be reported, right? What's vertical transmission? Look at your HESI prep.
Is it from pregnant women
Mm-hmm.
to their babies?
Yeah. Is that what you have in your HESI prep?
Yeah.
Yes.
Yeah. Anybody have
transition
a
from the
more
mother, yeah.
go ahead. Does anybody have a more detailed
I was
explanation
just
of
saying transition.
you're cutting out, Christina? Or whoever was
I'm
talking.
sorry, I have terrible service.
Sickness or infection that spread from pregnant woman to their baby during
Yeah.
pregnancy, childbirth, or breastfeeding.
Yep. Yep.
And it could be hepatitis B, Zika virus, HIV.
Yep. Yep. This next section is a pretty big section, encompasses a lot. Health promotion and teaching. We covered this concept through the term, but look at all of the different aspects of health promotion and teaching that the HESI will address. Infant death rates, resources. I guess what I would think from that would be, where do you get infant death rates? Where would you get that information? Resources. Where would you get that? Look at your HESI prep. You've completed that box. What did you put in there?
You can get it from the state health department or the CDC.
Exactly. Yep. Anybody want to add to that? Assessing obesity. Lipid screening. Why do we do lipid screening? What potentially do we do lipid screening for?
For cholesterol.
For what?
I said for cholesterol.
Mm-hmm.
The lipid panels looking for good cholesterol and bad, and the triglycerides.
Yeah. Yeah. Conjunctivitis. What do we want? What do we want to know about conjunctivitis? That could be a school nursing question, right? We see a lot of conjunctivitis in the schools or in the pediatric offices. What are we looking for? That would be a clinical judgment question. And I'm sure you put this in your HESI prep. What are the symptoms of conjunctivitis? How would we assess that?
It's also known as pink eye. So we will be looking for drainage,
Yep.
possible crust around the eye.
Yep.
It's caused by bacteria, virus, or allergies.
Yep. What happens with eczema in school sports? Why do kids get eczema doing school sports? What's the cause of it? Well, one of the most common causes is sweating, right? Sweating, rashes, football helmets, baseball helmets, equipment. Lead poisoning, action. What do we do? What's the action we do with lead poisoning? So I would think, what might somebody present with lead poisoning, and what are we going to do about it? Right? What if there's an actual exposure?
Yeah.
And you should have put this should have been in your HESI prep. When we think
household water should be tested for lead and certified.
Absolutely. Quality care high school population.
I'm sorry.
I would gather that, and I can address this from my school nursing experience. Quality care in the high school population. Well, a lot of it was preventative, a lot of teaching about drug abuse, tobacco, sexual assault, suicide prevention, just making sure that you're doing a lot of prevention education, and you're also doing a lot of screening for any potential issues with high school kids. And then if they do have an issue, which is tertiary, you're providing adequate resources and follow-up. Whether it's a teen pregnant mom that's in high school, or somebody who's had suicidal ideations. I'm just thinking out loud with you all about what kind of clinical judgment questions would be focused on the topic. What about a heart healthy diet? What about that? What is a heart healthy diet? And how do you teach somebody about a heart healthy diet? What is it?
Heart healthy diet is to reduce risk of cardiovascular disease by promoting
Mhm.
nutritious eating habits. So a patient
Absolutely.
with heart problems should limit red meats, beef, pork, lamb,
Mhm.
high fat dairy, decrease salt intake. Meat should be replaced with lean protein to include chicken, fish, beans, and legumes.
There you go. There you go. And again, this is a review for you guys, so I need you guys to jump in and but again, if you've done a if you've done a detailed job on your HESI assessment, this is just a review. How do you do it? How do you do an elder health assessment? What's important in an elder health assessment? What do we want to look at?
Health history.
Health history. What else? Remember, we're doing this in the community, so it might be in their home. What are we going to be evaluating for a health assessment?
The mobility.
Safety.
Mobility, safety, any environmental risks,
Their lifestyle.
lifestyle, any comorbidities, previous health history. Why do we do vision screening in preschool? What's the importance of that in the community, in the schools?
Early detection of vision problem.
Yeah, we're trying to do early detection of any vision or hearing problems that may
Lazy eye.
impact them. What?
Lazy eyes. Adiopia.
Yeah, lazy eye, or there's a multitude of issues that can be found in our preschoolers. I did this for 20 years. We were able to identify early on hearing and vision issues that not required, but encourage the parents to follow up with their pediatrician or eye doctor or uh, audiologist so that things could get corrected, or at least a plan going forward so that they were successful in the upcoming years in school, right? Scoliosis. Why do we do, what's a scoliosis screening? What are we screening for?
The nurse is looking for asymmetries in the shoulders, hips, and waist.
In the spine, right?
Yeah, so palpating the spine for abnormalities. Measurement should also be conducted
Yeah,
with the scoliometer to measure.
yeah, yeah, exactly. That's part of a routine screening. This falls under, care across the lifespan, right? These are screening in kids to like vision and hearing, just as a screening to identify issues early on. Seatbelts, I'm going to skip a few here. Seatbelt safety. What are we teaching with seatbelt safety? Or why are we teaching seatbelt safety?
Seatbelt safety we should promote constantly the importance of the safety of seatbelts, but it's also a high rate in adolescent deaths.
Exactly.
Yes.
Exactly. If you look at seatbelt, I mean, if you think back to your growth and development across the lifespan chapter, one of the most common injuries in adolescents are starting to drive are motor vehicle accidents from not wearing seatbelts. Community education, evaluate. Let's say you've put together a program for seniors. Okay. And how do you evaluate that your program has been successful? This HESI is very teaching focused, very outcomes focused. How do you
You
evaluate?
ask them questions. You ask them questions. It's to determine like if they understood what was said.
Mhm. Did they learn what was supposed to be, were the goals met? Were the objectives met? Is behavior going to be changed? Or maybe you didn't meet the goals. That's part of the evaluation. And things need to be revisited, right? That's why you evaluate. We know in the community that the resources are limited in the rural community. Why is that? What do we know about the rural community? Why are there limited resources? Anyone? Well, it's a rural community, right?
They're not available
Yeah, I'm here.
it's not stuff like a lot of stuff around them.
Exactly. No specialty care. It's all primary care, right?
Right.
Very little resources. If there's any kind of specialty diagnosis, cancer, pediatric issues, you got to travel, right? You got to travel to see a specialist.
Mhm.
When you're doing community risk findings, so you're out there doing your windshield survey, checking out the community, you're the community health nurse. What kinds of, I'm thinking, what are you looking for? What are community risks?
Chronic diseases, infectious diseases, environmental and occupational hazards, social
Poverty,
determinants. Yep. Lack of education, housing.
absolutely. Those are all the risks that we think about your vulnerable populations paper and think about that list of all the different populations you could have done. Right? Those are community risk findings. There's going to be those vulnerable populations in every community. What do we want to teach about skin health? Maybe that's a cancer screening question. Skin health. How do you maintain healthy skin? Maybe that's your screenings for rashes, for spots. Right? So what would you be
Yeah,
teaching?
so
What?
teaching a patient a daily routine, including cleansing and moisturizing and sunscreen, how to self-assess for skin tags,
Yeah.
small spots that may need biopsies done in dermatology, advise patch testing on small skin areas to check for allergic reactions as well.
Yeah, exactly. Food stamps, WIC, why is that there? What are they going to ask about WIC? Maybe what populations are eligible? What is it?
Yeah,
Meals on
probably.
Wheels?
And it's a community resource.
That's a community resource, right? Same with Meals on Wheels. Who does it primarily serve? Elderly? Maybe the risk is they live alone and can't cook or are unable to cook, and so these meals are delivered to them. What's the importance of neighborhood safe houses? What are they going to ask about neighborhood safe houses? Maybe why are they used? Why are they used?
These houses provide safety and support for vulnerable individuals, including domestic violence, children in
Exactly.
unsafe environments, and people facing immediate threats.
Exactly. That's a community issue. All those things Christina just mentioned are potential scenarios that happen in the community, whether it's on the street, on the corner, in the home, in the long-term care facility, in the schools, right? Next section is about home health. What do we think we want to know about NG tube feedings at home? What would be a clinical judgment question? Maybe go ahead, Christina,
Mhm.
go ahead.
Oh no, I was just looking up for the NGT two feed-ins, evaluating the patient's ability to possibly participate in their own care and reviewing the medical history and including the indication for the NGT feed-in and underlying conditions and potential complications.
Yeah, maybe when you're doing your assessment, they're having belly pain or diarrhea or something like that. How do you assess that maybe the NG tube, maybe not in the right place, or right? Think clinical judgment. What's respite care? Anybody else want to jump in besides Christina? What's respite care?
Respite care is when someone else takes care of the person you care for so that you can have a break.
Yeah, giving the caregivers a break.
Exactly.
a
Why is
small
that
break.
important? Why is that important? We talked about this in
So that the patient get the best care and the caregiver don't get overwhelmed.
that's exactly right. Because what do who do we forget about in the process of
The caregivers.
exactly. Why am I echoing?
Yeah, you are echoing.
I don't know why I'm echoing. We tend to forget about the caregiver, right? And the caregiver has to be looked after as well because we don't want the caregiver stressed and have burnout and potentially do things that they shouldn't be doing, neglect, abuse, right? We need to make sure we take care of the caretaker. Falling at home, what I mean, that's pretty self-explanatory. Home nutrition for the elderly, what's important about suspected abuse, home health, reporting abuse? What mandated reporting, right? We're all mandated reporters. Below the knee, this is a med surg question. Below the knee home care assessment. Or below the knee amputation home care assessment.
You
So
keep walkways clear and free of clutter or throw rugs.
okay. What do you teach somebody at home that regards to their ADLs that has COPD? Remember that quiz question about not removing the oxygen during their meals? How do you support a COPD patient at home with their ADLs? Frequent rest periods. What else? Small meals, not big, small frequent meals versus 3 big meals, right? You're caring for a patient in the home with cirrhosis. So you're going to have to teach them about what an ascites diet is. You filled that out in your HESI prep. Another med surg question, post arthroplasty, safety. What's the safety factor with caring for somebody that you're going to visit somebody that's post arthroplasty? What's home safety? What does that mean?
Making sure they have grab bars, elevated toilet seats,
Exactly.
handheld shower heads, at home. Try
Fantastic.
not to reach down to pick up something.
Yeah.
Remove tripping hazards.
Yep, tripping hazards. Yep, excellent. And now you're caring for a patient who's post-cabbage, right? Right? Tertiary prevention. What are some tertiary preventions post-cabbage? I mean, well, it's tertiary. They've already had the surgery. They've already had the cabbage, right? So what are we doing for them? It's a med surg question.
So with this one, so you want to create a individualized care plan just for the client, possibly to consist of exercise programs that are supervised
Exactly.
by the cardiac rehabilitation specialist. A comprehensive assessment is top tier, as well with a physical examination and functional status.
Yep. So what Christina just said that jumped out was a tertiary prevention would be cardiac rehab, right? You in tertiary, remember, is you're helping them manage something, whether it's a disease, post-surgery, an illness, a condition, an injury. So Christina's spot on. Cardiac rehab is a tertiary prevention for a CABG patient. Right? Couple things with infectious disease. The HIV risk factors. So again, I'm thinking maybe somebody's presenting. Think about clinical judgment. They're presenting with maybe signs, symptoms of something, and you're doing a screening and seeing if they might be at risk for HIV. Secondary prevention for STIs. What would be a secondary prevention for STIs? What is secondary? What kind of interventions are in secondary? Screening. So what would be what would be a secondary prevention? Give me an example, give us some examples of a secondary prevention for STIs.
Blood test.
What?
A blood test, like when you're testing
Yeah.
for, like,
Yeah. Screening. Exactly.
Yeah.
Active immunity, what's HBV active immunity? What's that? What vaccine is that?
The hepatitis B.
Right. Yep. So active immunity. What about hepatitis? Hepatitis A risk, hepatitis A transmission. What's hepatitis A?
Highly contagious liver infection caused by Hep A virus. Isn't that one? That's the one with the travelers out to regions with high rates of Hep A, such as parts of Africa, Asia, Central and South America, and Eastern Europe.
How is it contracted, Hep A?
Contaminated food or fecal oral route.
Yes. What about risk factors? We had a quiz question about PID risk factors. So again, think clinical judgment. What are your risk factors for PID? Remember that quiz question about abdominal pain, abdominal pressure? What are the other risk factors?
Unprotected sex.
Yep. Oh, what about TB? What's the epidemiology? What is TB?
Tuberculosis,
Right?
airborne.
Airborne.
We gotta teach them N95.
Yep.
Negative
Yeah.
pressure.
Negative pressure rooms. Where do we want to put them in the acute care setting?
By themselves.
Right? And let's say we have a TB patient at home. One
All
of the
the
things,
family needs to be tested.
what?
Family members need to be tested.
Yep. And also there's a medication regimen.
They have to adhere to all the medication.
Exactly.
So they have to report. I think they have to report to the nurse.
Yep. My sister currently has a non-infectious type of TB lung infection. And she has a PICC line and she's got many meds she's taken, but that public health nurse visits her, infectious disease nurse visits her every Monday to look at the medication, make sure it's gone. She has to save all her empty bags and her empty bottles of pills. They check in with her every week. It's mandatory that public health nurse checks in with patients on this regimen weekly to make sure they're taking their medication. Why would you do a screening x-ray? What does that come after? A positive what?
Skin test.
Skin test, positive PPD, right? The next step is the screening x-ray, right? Last was vulnerable populations, homelessness, cold exposure. So what do we think the clinical judgment, what's that gonna ask? Maybe if what they present with? what the environment is, what the situation is?
You can identify the individuals that's most at risk.
Yeah, there you go. Yeah, absolutely. And what would be a secondary prevention for tobacco? Screening. Screening who's at risk. Who's at risk for tobacco use? Used to do this in the schools, right? That's a secondary prevention, screening. So, I mean, again, if you study what you just completed and turned in Sunday, you're going to be fine. And I can tell you last term, our average for the January term was like mid 80s for the HESI. They did very, very well. And when I did my week 12 kind of end of term closing, students felt very confident that the HESI prep was extremely helpful. So if you spend some time doing it and we're nursing process focused from assessment all the way to evaluation, you're going to be fine. Going to be fine. Do you have any questions? Is this helpful? Go through it like this? Think
Yes.
clinical.
Yes, it was.
Think clinical. It's not going to ask you for the definition of TB. I don't think it is. It's not going to ask you for the definition of TB or the definition of something. You're expected to know that information and then apply it. That's that whole next gen pathway, right? So, what questions do you have? Are you confident?
Do
I'm
you know
always
if
confident
we have
now.
a lot of math questions?
There's no math on the HESI. Zero.
Okay. Oh, okay.
Take a breather. Take a deep
Yes.
breath.
Oh my God.
Yeah. Yeah. You guys will be fine. You guys will be fine. I think this
What
document will
about the
really
selection
help.
that apply?
These, my understanding is, and I think I've said this in class, Christina. That's why I asked you to go back and look at your, so we don't have CJ Sims in this class, but go back and look at your CJ Sims for your other classes. I think
Okay.
there's some questions that are, I think they told me last term, there's some questions that aren't CJ Sim, that style, right? Where you given the scenario and you have to answer, right? You guys have done CJ Sims and PEDS, right?
Yes.
Yeah. So, and again, that's also the next gen pathway to clinical judgment. So I don't think this isn't a knowledge definition exam. This is applying that knowledge. Okay.
All right. Thank you.
All right. Well, best of luck to you guys on your finals. Reach out, Christina, reach out to me. The rest of you reach out to your professors if you have any last minute questions before going into HESI. Okay. And good luck.
Thank you.
You're welcome.
All right. Thank you so much.
You're very welcome. You guys have a great weekend. Okay.
Thank you. You too.
Yeah.
All right. See you later.